Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for July 19th, 2023. Thank you for joining us this month. Our presenter today is Robin Gelburd. Robin is the founding president of Fair Health, a national independent nonprofit organization that serves as a trusted leader in healthcare cost transparency, data analytics, and benchmarks. Fair Health possesses the nation's largest collection of private healthcare claims data, which includes over 41 billion claim records and grows at a rate of over 2 billion claim records a year. Certified by the Centers for Medicare and Medicaid Services as a national qualified entity, Fair Health also receives data representing the experience of all individuals enrolled in traditional Medicare Parts A, B, and D. Robin is a nationally recognized expert on healthcare policy and health literacy and transparency. Selected as one of Crain's 2019 Notable Women in Healthcare, she has been invited to speak to organizations and federal and state agencies across the country and world. The title of Robin's presentation is Fair Health Shared Decision-Making Tools for Hip Osteoarthritis, Combining Cost and Clinical Information. Welcome, Robin.
Thank you so much, Katie, and thank you for the invitation to present today. It's a true privilege to share the work Fair Health has done and continues to do in furtherance of shared decision-making, particularly as it relates to orthopedic-related conditions, including hip osteoarthritis. For those less familiar with Fair Health, and as Katie mentioned, we're a national independent nonprofit established to bring fairness and integrity to health insurance information. We were created out of a national demand for a standardized, comprehensive, and trusted data source to help all stakeholders have confidence in the information presented. We meet that need by having the largest collection of private insurance claims in the country and by being prudent stewards of that data. We now have it's 42 billion now because it continues to grow, 42 billion private insurance claims from 2002 to the present. We receive over 2 billion new claims each year, and the data are organized into granular geographies to help capture the relevant healthcare market and to align flexibly as needed with various legislative and regulatory geographic configurations. The data are received voluntarily, typically monthly, from over 70 national and regional payers and third-party administrators, and reflect both self-insured and fully insured covered lives. Our independence, coupled with the breadth of the collection and our robust auditing and validation methods, helps engender trust in the data and in turn, trust in the institutions and organizations using our data. Apart from our commercial data collection, as Katie mentioned, we are certified by CMS as a national qualified entity and thus entrusted with the entire collection of parts A, B, and D of the Medicare data set for all 50 states dating back to 2013. Currently, that collection of data accounts for approximately 45 billion Medicare claims, which are housed separately from our commercial data. Medicare Advantage data is housed with our commercial collection. Fair Health uses its database in part to power a free consumer website called Fair Health Consumer, which helps consumers understand their health benefits, plan for their healthcare costs, and make the most of their medical and dental coverage. The site offers medical and dental cost lookup tools, a robust, homegrown educational curriculum on various topics relating to navigating the healthcare system, glossaries, content on healthcare quality, and links to external resources such as patient disease organizations and government agencies, among others. Fair Health Consumer is available in both English and Spanish. As you can see, there is an English-Spanish toggle in the upper right-hand corner of the site. It should be noted that the entire site is translated into Spanish, not just the educational content. We sought permission from the American Medical Association to translate the CPT code set into Spanish so that Spanish-speaking individuals could assess the accuracy of the procedures listed on their EOBs and medical bills. Also available in English and Spanish is our free educational app, FH Consumer Classroom, which includes all of the content available on the consumer website, as well as insurance-themed games to test user comprehension. The Fair Health Consumer website has received honors from healthcare sector and government leaders for its critical, user-friendly tools for advancing health insurance literacy and promoting healthcare cost transparency and engagement among consumers. Such honors include those from the White House Summit on Smart Disclosure, the Agency for Healthcare Research and Quality, the eHealthcare Leadership Awards, Employee Benefit News, and Kiplinger's Personal Finance, among others. It also gets frequent unsolicited shout-outs in the press and other media outlets as a valuable consumer resource. Now, let's turn more specifically to shared decision-making, or SDM. For those less familiar with SDM, it is the process by which patients, their caregivers, and healthcare providers collaboratively decide on tests, treatment, and care based on clinical evidence, balancing risks and outcomes with patient preferences and values. It is typically facilitated by decision aids. Until Fair Health entered the shared decision-making space, such tools lacked a cost component. We heard from SDM experts around the country that when they offered clinical decision aids showing various treatment options, often the next question from consumers would be, what would this choice cost compared to the other choices? Fair Health now integrates cost estimates drawn from our rich claims data collection with certified decision aids to provide that missing puzzle piece that has been sought by patients and their families. Fair Health has advanced several groundbreaking SDM initiatives through generous grant funding from multiple organizations. In 2019, we received our first grant in support of SDM from the New York Community Trust, which had publicized its interest in advancing professional education around palliative care. With that grant, Fair Health created and launched in March 2020 a shared decision-making section on the Fair Health consumer site with 3 decision aids, which include both clinical and cost information for 3 scenarios common among seriously ill patients. Those scenarios include dialysis for people who are seriously ill, nutrition options for people who are seriously ill, and ventilator support for people who are seriously ill. Our work with the trust caught the attention of other funders. At the invitation of one such funder, the Fan Fox and Leslie R. Samuels Foundation, Fair Health undertook a separate program to promote SDM among providers who care for older adults. Through that project, in April 2021, we launched a provider-centered website, Fair Health Provider, which offers palliative care decision aids, resources, and educational content to support providers in having shared decision-making discussions with their patients and the patient's caregivers. On the heels of the first 2 successful initiatives, Fair Health received a grant from the New York Health Foundation in support of an SDM program geared for minority patients in New York State. This project involved the development and May 2022 launch of 4 new decision aids with treatment options and related costs for conditions pertinent to minority patients. For that project, we developed SDM resources pertaining to uterine fibroids, slow-growing prostate cancer, and type 2 diabetes. Our most recent shared decision-making projects are funded by the John A. Hartford Foundation, a prominent national voice for improving the healthcare of older adults. Our first initiative funded by the John A. Hartford Foundation, which concluded at the end of 2022, included the development and dissemination of tools relevant to conditions that affect older patients, together with educational content and external resources for the conditions. The SDM tools launched in connection with that project pertain to hip osteoarthritis, both non-surgical and surgical treatment options, hip replacement, spinal narrowing or stenosis, early stage breast cancer, and fast-growing prostate cancer. For this project, we also launched total treatment cost scenarios for Alzheimer's disease and related dementias, heart failure, and major depression. These total treatment cost scenarios, or TTCs as they are often referred to, provide patients and their families with a three-dimensional view into the services they may need and the related costs they may incur for these conditions. The tools and related content were promoted among older patients, family caregivers, and providers in 4 major media markets nationwide: New York City, Los Angeles, Atlanta, and Chicago. The second initiative is currently underway and builds upon the success of the earlier pilot project. The second project, national in scope, involves promoting awareness of SDN tools among older adults and family caregivers and implementing the tools at the point of care in collaboration with 4 clinical sites nationwide. On this slide, we see the tools just described in connection with these various grant-funded initiatives. Today, we'll focus on 3 tools listed under the older adults bullet: non-surgical treatment options for hip osteoarthritis, hip replacement, and spinal stenosis treatment options. Now let's take a closer look at some of these resources. The landing page of the SDN section of our consumer website provides an overview of SDN and its uses. As you can see, the top navigation bar of the site prominently features our shared decision-making platform. On the right side of the page, you can find our current array of decision aids. Here we are looking at the older adult section of Fair Health Consumer, which was added to our site as part of the initiative to advance shared decision-making among older adults. It can also be accessed via the top ribbon of the consumer website. As you can see, this older adult section features a range of educational content, resources and tools, including our SDM tools, TTCs, which as just mentioned, detail the full range of costs for certain acute events, procedures, and chronic conditions, a financial health literacy section, toolkits and checklists for shared decision-making and for navigating the healthcare system. It also highlights other tools available on the consumer website, such as Fair Health's comprehensive medical and dental cost lookup tools for thousands of procedures and our healthcare quality toolkit. One of the decision aids developed in connection with the Older Adults platform helps patients consider whether or not to pursue a hip replacement. It includes a series of common questions asked by patients when considering hip replacement. For example, the second question asks, will surgery help my gain and function? The answer includes statistics on the results of hip replacement surgery. It presents that out of 100 people who receive the surgery, 90% have less pain for many years, and 75% have better function for many years. It also mentions that some individuals still need pain medicine after hip replacement. In addition to hip replacement, the consumer website houses a decision aid for non-surgical treatment options for hip osteoarthritis. On this page, descriptions of each treatment option are presented, as well as other questions related to non-surgical treatment of hip osteoarthritis. The non-surgical treatment options include self-management, physical therapy, acetaminophen or NSAIDs, and steroid injections in the hip. If the patient chooses to do so, they can go to the next page to view the associated costs of their selected treatment. The cost information offers a detailed breakdown of the treatment options' relevant services. In this case, the option selected was physical therapy, as well as a comparison of in-network costs in red and out-of-network costs in blue in the patient's geographic area. The final shared decision-making tool is the decision aid for spinal stenosis. It provides the same questions as the hip osteoarthritis decision aid, as well as the treatment options, which include self-care, physical therapy, epidural injections, and surgery. As noted earlier, to educate consumers about bundled models and to provide total treatment cost scenarios, we offer an additional feature on the website that details the full range of costs for certain acute events, procedures, and chronic conditions. We offer this feature in order to keep consumers aware of changes and reforms underway in the healthcare system. And as you know, some payment models involve bundled episodes. Among the robust list of total treatment cost offerings is hip replacement and knee replacement. Here's a sampling of the easy-to-digest return of information associated with the hip replacement bundle. Again, we offer the information from an out-of-network and in-network perspective. The services included on the results page range from the cost of anesthesia to the cost of durable medical equipment. And here we see the total cost associated with a knee replacement. In addition to the decision aids with clinical and cost information, we also offer checklists that include some other questions or considerations to help patients and family caregivers with the shared decision-making process. Here is a screen grab of a patient SDM checklist with suggested questions to ask. Notably, as part of our evaluative process for our grant-funded projects, we've been hearing from consumers and providers alike about how useful these checklists are when preparing for conversations and navigating the healthcare system generally. The older adult section of Fair Health Consumer also features a section with links to external resources, including governmental resources, patient disease organizations, and support groups for family caregivers, among others. We also created a financial health literacy component for the older adult section to combat against the growing issue of financial toxicity. Financial toxicity is the financial, emotional, and mental burden patients experience from medical costs, which can lead to diminished access to care and reduced quality of life. In addition to helping advance financial health literacy among older patients and their caregivers through shared decision-making tools, we also offer educational information on understanding and managing healthcare costs, as seen here. Consumers can also access the Fair Health Healthcare Quality Toolkit, which offers information about characteristics and measures that may point to the quality of healthcare providers and help patients select a provider or facility. And here we see Fair Health Consumers educational platform, specifically our homegrown Insurance Basics curriculum, which covers a range of topics pertaining to health insurance and navigating the healthcare system. We have over 40 articles and counting, and we add new articles regularly, so the content is continually refreshed. For example, we offer topics pertaining to surprise billing, appealing a reimbursement decision, understanding your medical bill, preventive services, wellness programs, and choosing a healthcare provider, among many others. Among the Insurance Basics articles, we have 3 articles dedicated to shared decision-making. One such article, pictured here, helps contextualize how the tools can be used with providers when making decisions. As mentioned earlier, with the generous support of grant funding, Fair Health developed a provider-oriented educational website to offer guidance on integrating SDM in discussions with patients and caregivers. Providers can access the decision aids from this free website and use it to direct their patients to the SDM resources on our consumer site. The provider site includes an introductory explanation and overview of shared decision-making for providers less familiar with this paradigm of care. The provider-oriented website also houses the new shared decision-making tools and resources focused on the care of older adults. As part of our SDM initiatives, Fair Health conducts program evaluations to understand the impact and utility of our tools. To conduct these evaluations, we use both qualitative and quantitative methods, including website usage analytics, social media engagement analytics, surveys, focus groups, and qualitative feedback sessions with providers and relevant experts. Overwhelmingly, we observe that shared decision-making tools are useful and valuable for providers and patients alike. Stakeholder feedback also revealed that providing cost information in shared decision-making conversations enhance decision-making. If you would like to read these program evaluations, you can access them on our website at the link included on this slide. We're grateful to have received this feedback and have threaded these valuable observations into our ongoing initiatives. Thank you so much, and I'm now happy to address any questions you may have.
Thank you, Robin. That's some wonderful information that you presented and that you have available on your website. Just to get us started here, I do have a question for you, but I'll invite anyone else in the audience to type their questions into the chat, and then I will read them aloud. To kick us off, I wondered if you could tell us a little bit about the cost estimates on your website. The ones that you showed us, for example, are those based on insured or non-insured consumers or a combination?
So the data itself is based on insured patients to the extent that all of the claims we receive are based on an interaction that a patient has with the healthcare system. When they touch the healthcare system as an insured member, that claim that gets forwarded to Fair Health. However, the data that we have reflects both in-network and out-of-network costs, as I mentioned. The in-network is for those people who are trying to track and manage their deductibles, potentially against a high deductible health plan, so they will know what their out-of-pocket costs will be. The uninsured estimate the out-of-network estimate on the site reflects what either someone would be responsible for paying if they go out of network and they elect to go out of network because of a recommendation, for example, to an out-of-network provider. It would also be relevant to uninsured patients because they would not have any insurance that would tap into that in-network estimate. So it's really available in our views for both insured and uninsured.
Okay, thank you for explaining that. One question I had related to osteoarthritis. I know that you showed the non-surgical treatment of osteoarthritis, and I'm sure it's difficult because you don't necessarily have claims data on the, the self-management strategies. But I wonder if there's any way to extrapolate how to compare costs for things like exercise or managing it on their own versus using a health insurance billable service like physical therapy or insurance. Like if a patient is trying to decide their best course of treatment, is there any way for them to factor in the cost of some of those self-management strategies?
Right. Well, fortunately, at Fair Health, most of our data contains a de-identified member ID. So we can actually track patients as they migrate through the healthcare system. And one way to gain some access or insights into the questions you're asking, Katie, is that if we see someone with a certain diagnosis, like hip osteoarthritis, we can track that individual and determine whether they've had surgery or have not had surgery, whether they've had PT or how much. If they haven't had surgery, whether they are then, after some period of time, returning for surgery at a much later date. There are health plans, as you know, sometimes do reimburse for certain kinds of non-surgical treatments, exercise and so forth, almost, therapeutic massage and so forth. So to the extent that there's a code associated with the service, that would also be reflected on the claim. So there's a lot that we can discern, and the claims do sort of tell a story as we follow people through the healthcare system and can make certain determinations.
Okay, and so it sounds like you're doing a lot with the data beyond just making it available for patients and providers. You all are doing some of that investigation to kind of follow the patients.
Yes, we do that in many respects. For example, we are in the process of studying telehealth as a source of care and following patients to see, once you've had a telehealth service, how many return to an in-office visit with that same provider, how many people have their conditions escalate, or to what extent they adhere to certain treatment protocols with behavioral health or otherwise. So yes, there are many things we can glean from our billions of claims. We're fortunate to provide that window to the healthcare system.
Yes, you really are. You do have a wealth of data. Glad to know that you are doing some of that work on it. And out of curiosity, are researchers or other people interested in doing research in the data able to access it in a similar way?
Absolutely. We do our own internal research, whether it's on COVID or the opioid crisis, and et cetera. But we also support researchers with their studies. And we are always happy to help them answer some of the questions that they're probing. We do it in a very neutral way. We have no bias. We have no point of view, but we provide basically the raw ingredients, not necessarily the line level data, but data sets that help them create the kinds of studies that are of importance to them.
That's great. I know there may be some people on this webinar who could be interested in using some of that data. So thank you for mentioning that. One question I have is kind of two-part. Again, there may be clinicians or even patients or others who would be interested in sharing this information with their patients or their colleagues. What's the best way to do that? And secondly, how do how does your organization share this information? Because it seems so valuable for patients. So how do you make it known to patients to help them make these important decisions?
So first of all, let me emphasize that these tools are available at no cost. They are totally free to providers and to patients and their caregivers. As mentioned, they are obviously available to patients and their caregivers on the fairhealthconsumer.org website, as well as to providers through the fairhealthprovider.org website. We were thrilled to receive that extra grant that allowed us to create that provider dedicated website to really close the circle of those conversations. To easily share the tools, we can provide one-pagers, newsletters, website blurbs for people's websites, if it's different types of organizations, hyperlinks on those other websites that go right to our consumer website to allow for easy access to them. We also offer, organizational trainings and webinars such as we're doing here to help explain the different components of the tools and how to use them. For those on the call, if they'd like to reach out to us offline to potentially arrange for such an in-service training or webinar, we're happy to do that. And we're always happy to help support different kinds of content and materials that can be circulated, obviously at no charge.
Great. And we will be including links to some of these websites that you mentioned, obviously your main website and the healthcare provider and some of the other web pages that you mentioned. So that will go out in the follow-up email. We did have a question related to the research side of things and accessing the database. What's the process to request and conduct research on your claim data?
There is an information number, as you can see on the slide here. They can either email us or call. We will put them in touch with our research team. And the process typically is we hear about the area of focus of the researcher. We try to make sure that we have statistically significant data in our repository that aligns with the subject matter that is being studied. Once we determine that, we try to help craft a statement of work that really pointedly addresses those questions and helps extract the data that would be most relevant. And then that is embodied in what's our standard data license agreement that we're required to do because we are obviously the repository for all of these different data collections. And then we either prepare data visualizations and certain types of data reports for the researcher, or we give them the data sets themselves to work with and do their own studies. So we have many different ways in which we work with researchers along a continuum, depending on their capability of working, with facility with those data sets.
Great, thank you. So we're going to take one last question here, and this is again kind of a two-parter. First, we had a question from the audience about knee replacements. So I know that you have some cost data about knee replacements, and you obviously have the decision aids related to hip OA and hip replacements, but do you have any information or shared decision-making tools about knee replacements? And second part of that question is maybe you could just mention any plans you have for future kind of avenues with those shared decision-making resources.
Sure. So right now, currently, there isn't a knee replacement. That is something that we will hope to add as we go on. We have been really fortunate to be incrementally building this body of shared decision-making work on the site, as we mentioned first with the palliative care scenarios. Then we had that great opportunity with the New York Health Foundation to add other decision aids that were particularly relevant to minority populations. And then we were thrilled to be working, obviously, with the national preeminent organization, the John A. Harper Foundation, to add all of these other decision aids, particularly to older adults. We are always looking to enrich this shared decision-making section by adding new decision aids, as well as really working with clinical organizations that could see these resources at the point of care. So we can not only on the micro level help patients directly with those conversations with the providers, but at the macro level, use those pilot sites to start amassing qualitative and quantitative data that would allow us to really see the impact and the efficacy of these shared decision-making resources.
Wonderful. So stay tuned and check your website. It sounds like more to come, more resources in the works.
Exactly.
Wonderful. Well, thank you so much, Robin, for this presentation at the Osteoarthritis Action Alliance. We're delighted to have made the connection with your organization and to share these resources with our network. So thank you very much for your time and your expertise today. And thank you to everyone for joining us. In just a minute, I am going to launch a brief satisfaction poll. So if you have the chance to take that before you leave, we would appreciate it. Finally, just want to mention that next month's presentation will be on August 16th, and it will feature Dr. Linda Lee, who will present the use of digital technology to support a tailored approach to physical activity in people with arthritis. Hope you can join us. We will include a link to the registration for that webinar in the follow-up email. Thank you so much, and hope everyone has a wonderful rest of their day.